Hi, I'm Amber, and welcome to the Lone Star Keto podcast. Today we have a very special guest with us, Dr. Barb Woegerer. And she has an ER at the end of her name, and you want to pronounce that, but you don't. It's just Woegerer. So when you're looking her up, be sure you got that right. I am the worst. Well, welcome, Barb. How are you?
I'm great. Thank you so much for having me on your podcast. I'm so excited to be talking about my favorite thing today with you.
Yes, and what we're going to be talking about is magnesium. And that seems to be a really hot topic right now. And I'm kind of one of those people who are a little resistant to do supplements because it's like, I don't want to take pills. But this seems to be an increasing thing that keeps coming up that most of us are deficient in. First of all, Dr. Barb, can you give us a background, like your education, why you got into this and why you're interested in magnesium?
Yep, for sure. So I'm in Toronto, Ontario, Canada. So I'm a licensed naturopathic doctor, and I got into naturopathic medicine. I was actually doing a lot of holistic nutritionist work prior to that. I had a holistic nutrition degree, and I was seeing patients, and I just felt I needed more in-depth knowledge. So I decided I was going to go and do naturopathic medicine. And so I went back to school and did all the 5 years of med school, and here we are. And so that was really my passion. I had always been involved in healthcare and love it so much. But during probably my first or second year in practice, I discovered magnesium, and I was using it with patients quite a bit in different scenarios. And I couldn't believe some of the drastic results I saw. And I was like, wow, what is it with this mineral? Because we didn't learn much about it in school. And so I started getting into the research and getting all the, background on it. And I was just fascinated by how much this one mineral did and why we never spoke about it and why it was never talked about. It's such an appreciated mineral, I find. And so I made it my mission to, get all of this information out to people so that they could appreciate what this mineral could actually do for us health-wise. So hence why I talk a lot about magnesium. And but I am in private practice as well in Toronto, and I mainly deal with women's hormones, stress. We do a lot of inflammation work. And of course, magnesium's a part of all of that.
Awesome. Okay, define for me, what is a neuropath doctor? Why is that different than just, a regular doctor, I guess you'd say?
Okay, so a naturopathic doctor is actually so we are a regulated profession. So we have to do 4 years of schooling with a full year of interning. It's a doctorate degree. So it's basically going to medical school, learning about all of your allopathic medicine. So you need to understand the physiology and the biochemistry of the human body. And then we also have natural approaches and alternative complementary approaches that we also are taught. And so it's kind of like a combo. So yeah.
Very cool.
Yeah.
That's very cool. I think that's probably what I would have liked to have done. Okay, so when you were in school for this, and you talk about how you didn't really learn much about magnesium, did you learn anything about nutrition either?
We did. We had lots so we learned nutrition from a very biochemical sense, but not from a mineral and vitamin sense. So we learned about cofactors and how they were implicated in certain disease processes and illnesses and stuff like that. So it was we had a full, I would say 3 years of nutrition built in with different physiology and anatomy and biochemistry. So yeah, we were lucky enough to get that. But magnesium was never, because it's a micro nutrient, like a micro mineral, it's not talked about a lot. So they really focused on the big ones that, the irons and the vitamin C's and the A's and the D's, because these are all big, huge vitamins that are also, they do a lot of stuff as well, but are much further along where like people understand what they're there for and why we need them. Yeah.
Yeah. Well, that's very cool because, you know, you always hear so much about how nutrition and diet is really not, you know, talked about much in med school. So I love that you had that. Too bad you didn't have a little bit more of, you know, what you now learn about
Yeah.
magnesium and other minerals. But
Right.
yeah, that's good that you got that. That's awesome.
Yeah, there's only, I mean, I think there's only so much that they can teach you, and then the rest you kind of got to pick up like on
True.
your own, right? There's only so much time that they have with you.
Thank goodness.
Yes. Yes. So, but you know what? It's good because it made me realize and I now also speak at the school that I went to, and also address people about magnesium and stuff. So yeah.
That's awesome. Well,
Yeah.
it made you curious
Yeah.
once you started kind of figuring out things. So that's really cool. Okay,
Yeah.
so let's get into the good stuff. Okay,
Yes.
why is magnesium so important? Just kind of give a generalization, and we'll get more specific later. Why so
Sure.
important?
Well, I think what most people have to understand is that magnesium is involved in the research over 700 enzymatic reactions. So what that means is it has its hand in almost everything, whether it's hormones, whether it's thyroid, whether it's brain health, kidney health, liver health, inflammation. Like, it's got its hand everywhere. And it's actually a cofactor in a lot of different processes. And what that means is you need magnesium in order to do certain processes in the body. And if you don't have it, then that process is not going to work the same way. And most often that results in symptoms or signs that, you know, magnesium's not doing a job or not properly because there's a deficiency.
That's so
Yeah,
interesting. Is there any other mineral or vitamin that plays as many parts that you know of?
I don't know of any other
Wow.
vitamin or mineral that does. I mean, we have other vitamins and minerals for sure, but they have very specific,
Right.
you know, factors. Like vitamin D is very immune health. And although it does overall health, it starts with the immune system, right? And vitamin C, again, is more immune health. So they have their individual little components. But none that have as many as magnesium. And that has evolved in the research. I mean, we started with 300 enzymatic reactions that it was involved in. And as they've been doing more research on this mineral, we are now at over 700. So
Wow.
yeah,
Wow.
yeah,
That's fascinating.
yeah.
Okay, so talk about some of the deficiencies. How do you know that you don't have enough magnesium? What's seen, like symptoms or, you know, those kind of things?
Okay, so that's I think some of the problem with magnesium deficiencies is that a lot of the symptoms of deficiency are actually symptoms of other illnesses. And so this is why often we do not get to that root cause that there is a magnesium deficiency, because it's kind of grouped into, oh, you have insomnia. And so obviously a lack of sleep and not being able to sleep is a magnesium deficiency. Joint pain, joint tenderness, any type of stiffness, arthritic, a lot of that is a magnesium deficiency. Insulin resistance is a magnesium deficiency. So there's a lot of things that the deficiency side looks at, but are also put into other categories of illness, which is why we often miss it. And I think that's why we don't hear about magnesium in the same capacity, because a lot of those symptoms are underlying. So mood, for instance, like magnesium plays a huge role when it comes to our brain health, our mood health, our neurotransmitters, those types of things. So yeah, I mean, I could list so many different deficiencies, and, you know, you could also put them in with other different types of diagnoses. So definitely, like I said, it has its hand in so many things. And, you know, we can see those deficiencies when those issues are actually dealt with, and we know it was a magnesium issue.
Wow.
Yeah.
Yeah. Okay. So in your practice,
Mm-hmm.
what is one thing that you've seen where magnesium seem to have helped the situation that most people would be going, oh, that's weird, or something that even surprised you maybe? What is one of those, you know, kind of out of the box things that you would just not associate it with?
Well, I can tell you, the first 2 times I used magnesium, I'll go back to when I first started, and I had 2 cases, and one of them was an ADHD case, and one of them was a insulin resistance case. And it was the insulin resistance case. They had tried many things. They had gone to many different practitioners. They had done a lot of different types of therapies, but yet they were still having this problem with insulin resistance. And I was like, and I had quickly done a couple of researches before the patient came in, and I came across this research that magnesium sensitizes the insulin receptors. So it makes the insulin receptors more receptive to insulin. And I thought, I wonder if I just gave this woman magnesium and what would happen. And she also had some cholesterol issues. And magnesium also helps with cholesterol because it's an enzyme that blocks the coenzyme that makes cholesterol. So basically when we take a statin, it's blocking an enzyme so that your body doesn't make this cholesterol, and so does magnesium. But, and insulin resistance and cholesterol are often together. So I gave this woman magnesium, and we started really low. We started at a 200 milligram dose, and we didn't see anything dramatic. And then I increased the dose to 400 milligrams, and she was like, I don't feel hungry all the time. She had, like, we tried intermittent fasting with her. She couldn't go more than 6 hours, and she would become shaky and she would want food, and you knew there was some type of insulin response happening. And all of a sudden she was fasting 12 hours. We were going 16 hours. I mean, the response was so amazing. So I did supplement her for 3 months, and then we went and checked her insulin markers on a blood test, and they had cut in half. So in Canada, we want to be below 50 for fasting insulin, and she was at 100, and we got her down to 50 in 3 months.
Wow. Wow.
Yeah.
So did you change anything else? I mean, like during this time, was it just mainly the magnesium, or did you also try to change your diet, or, you know, any other factor that might play a part?
She had done a lot of work before coming to
Okay.
see me. So her diet was pretty good. It was
Okay.
not something that I needed to really do anything with. The only thing that we really implemented when she was able to was the intermittent fasting.
Okay.
So I'm sure that some of that had something to do with it as well. But we didn't get to do that right away because she couldn't fast more than 6 hours. So we had to go in stages. And as we got the magnesium into her, probably after about the first month, she was able to do 12 hours.
Nice.
Without
Wow.
having that, craving for, needing something to eat, and that she would get into real, like shaky, like blood glucose issues, right? Like almost like a hypoglycemic at that time. So that was my first case, and I was like, wow, this is really great. So, and I really didn't, I thought, oh, great, it worked, and all is good. And I really didn't look into it further after that case until I came across my second tough case with, it was a little boy who had ADHD, and they had been again to neurologists, to, dietitians, and they had seen a lot of practitioners. And again, in the research, it was like ADHD and magnesium. And actually, I did B6 and magnesium with the ADHD case, because in the research, it shows these two components work really well together. And when I actually tested this boy's magnesium level, he was really, really low. So, and that is what they find with a lot of these ADHD patients, is that they have very low magnesium levels. And so the hyperactivity that you see in these cases is really blunted by that magnesium B6 combo. So yeah, and it's amazing what it can do. It's just so fascinating when you can give such an inexpensive mineral and they don't have to go buy all this fancy stuff. Like, you know, and I remember the mother saying to me, so you just want to give magnesium? Because they had already been taking B vitamins, because that's a protocol for ADHD anyway. And I was like, yeah, we're going to put this in with your B6 and we're going to see how it works. So the B6 on its own did not do the trick. It was when we added in the magnesium with the B6 that it actually worked out really well. Yeah.
That's fascinating.
Yeah. Yeah.
I mean, if this is really something that works, oh my goodness, we could get all these poor kids who are just living their life like a zombie off that, you know, crappy medication, and, you know, through diet and some supplementation. Wow.
Yeah.
That's incredible.
Well, and the study that I looked at, that I actually got it from, was they had taken, and they took, I believe it was 200 milligrams of magnesium, and they did this 8 weeks. And they did 2 groups. So they did a B6 and magnesium group, and then they did a magnesium and the standard medication group. So they wanted to see if they could see differences between the standard medication and just the magnesium and B6. And actually the magnesium with the standard medication saw like huge, like significant improvements in hyperactivity that they weren't getting from the medication alone. So there's even something there that's saying that that medication, even for it to work, needs to be activated by magnesium somehow in those cofactors. And when they did the magnesium and B6, then they saw less aggression, less instability, less attention, like more attention at school, and they just saw the same results. So that's what kind of caught my eye. I was like, well, if magnesium's helping with standard medication, and aside from standard medication, there's got to be something there.
That's amazing.
Yeah.
That could be such a huge thing.
Yeah.
Why do you think we don't hear about this more often? Is it just because the knowledge is just flat not there, or is there something keeping that knowledge from being spread?
I don't think that it's keeping the knowledge, because if you go and you actually get into a lot of the research databases, it's there. The magnesium stuff is there. It's they've done this research. I think it's just because it's a micronutrient, it's a micro mineral, and we just don't assume that it does as much as it does. And like I said earlier, a lot of the symptoms of the deficiency are actually symptoms of those common illnesses or diseases. So if you have a hyperactive child, you're not thinking magnesium, right? You're thinking, okay, I need to calm this kid down. There's something obviously going on in the brain that is causing this hyperactivity. And so people just don't think about it. And it was my mission after that case is when I really got interested, and I was like, okay, there's something here. We need to get this out and to people so that, you know, they understand like this. And it's not an expensive supplement, right? Like if you have to supplement, it's not expensive. It's not something that's going to, and you can get it anywhere. So as long as you're getting the right form, this is the other thing, right? So, but anyhow, it's just, yeah, like I don't find like we don't get, it's really not information that's readily available. I think it's available, it's just not getting out there. So I've kind of made it my mission to bring that out to the people. Yeah.
That's awesome. I mean, like you said, it's inexpensive and it's easy. And if you can get off some of the medication, oh, that's like so incredibly worth it. I love that.
And the other thing that's really great about it, because you have to worry about this, especially like with patients being on several medications, and like magnesium is a fairly safe mineral. So interactions aren't that big. I mean, there are some. So if you're on hypothyroid medication or something like that, you always want to take it away 4 hours. And then the only people that really have to be concerned about magnesium are people with kidney disease, because magnesium is filtered through the kidneys, right?
Mm.
So we want to be careful with people that have some form of kidney disease. But it's relatively safe in the general population. It's safe in pregnancy. It's safe in breastfeeding. So like, it's not something that has a lot of interactions and that interacts with a lot of different medications. Yeah.
Win-win right there. Wow.
Right.
Yeah. You know, the more I'm learning about magnesium, the more I'm like going, okay, maybe I'm going to believe some of this, because in the carnivore community, it is pretty much talked about. Same with keto. You do hear it, you know, as far as electrolytes, those kind of things, you know, that you need magnesium. But honestly, for me, I'm like, I'm probably good. I'm not feeling anything bad. I don't really have symptoms, so I'm doing good. So I just never really paid attention to it until I keep seeing things more and more. And then I read your post and I'm like, maybe I have to be doing even better. Maybe there's something to it.
Right.
And, okay.
Right.
And there's something I want to get into detail about, because we see this way too often, thyroid issues, you know, whether it's Hashimoto's or, you know, things that are even worse.
Right.
Go through how magnesium helps out. What is the science behind that? How does that help?
So it helps in probably 2 big ways. And then it also obviously decreases the risk of any type of goiter, because it works with iron and iodine in order to not create that goiter. But the 2 big things is magnesium is going to increase TSH. Because again, it's a signal from the brain to the thyroid. And so magnesium plays a big part in our brain health and in our neurotransmitters and in the communication between the brain and the thyroid. So the first thing it does is it produces more thyroid hormone. It also then plays a really big part in getting T4 to convert to T3. So T4 is our inactive thyroid hormone, and we usually have a lot of that. And where the problem comes in is in the conversion. So people have trouble converting that inactive thyroid into the active thyroid, which is T3. So it helps to convert those that transition and make sure that you have more of the active hormone available. So it's involved in that. And then of course it if we have an autoimmune condition like thyroid, so Hashimoto's, because autoimmune has that underlying inflammatory component, magnesium is going to quiet that inflammation and also help those thyroid hormones do the conversion that it needs to do. Because if the thyroid is sending multiple like signals, let's go, we're going to see TSH starting to go up because it's not responding, right? So our brain is sending it, but our thyroid's not responding. And so then we have trouble sometimes even making getting that T4 into the T3. And so of course we see lower levels of T3, which is going to decrease energy, slow things down, slower metabolism. And then we're going to also see antibodies if we're talking autoimmune. And those antibodies are just a sign saying that the immune system is on high alert all the time, and there's this inflammatory process. And so we always want to look at antioxidant support, which magnesium is as well as, of course, your A's and your C's and your E's and zinc and those kinds of things. Yeah. So they all kind of work together. Yeah.
That is fascinating.
Yeah. And it's, I know that there's, your standard stuff for thyroid, like iodine and selenium and zinc, and those are important too. I'm not saying that they're not, but a lot of the times the magnesium is not included in that thyroid group. And yet it's so important in making those conversions happen.
Wow.
Yeah.
Okay, that's huge. Okay, so another thing you talk a lot about is how important magnesium is for women's health. And specifically, let's talk about estrogen and also things like PCOS. I hear so many people talking about getting diagnosed with PCOS. That's huge. I mean, what's going on?
Okay, so when we're dealing with PCOS, we're seeing insulin resistance a lot of the time. So we see this underlying inflammation that's happening, and then we see this insulin resistance, and this is often causing weight gain. It's often causing hormonal imbalances, especially with testosterone and estrogen. And so as a result, we're then seeing missed periods, no periods, infertility, weight gain, hair growth, those kinds of things. So the first thing that magnesium does is it deals with insulin resistance. So it has this special relationship with insulin, and it makes the insulin receptors more sensitive. And so it helps. Actually, a magnesium deficiency creates an insulin resistance response. So if we're deficient, we are more prone to have insulin resistance happening in the system. So we really, that's the big underlying component that's happening in PCOS. So we want to make sure that we are addressing that insulin resistance, and magnesium is definitely on the list for that. It's going to also, a lot of PCOS patients have elevated cortisol because they're stressed, they're anxious because, all this stuff is happening to them. And magnesium is going to come in and kind of slow that nervous system down, slow down that production of your norepinephrine and epinephrine and cortisol, and kind of let that system just ride so that we're not sitting on elevated cortisol. Because again, elevated cortisol is going to increase your insulin resistance. And so it's a vicious circle, right? It just kind of goes all over. But the most important part is the stress, the anxiety, and the inflammation, as well as the insulin resistance. And magnesium touches on all of those because, especially with the stress and anxiety, magnesium, it goes towards the GABA receptors in the brain. And the GABA receptors are very calming and very inhibitory. So it's not excitatory neurotransmitter. And so it causes that relaxation. So you can really nail 4 big things with one supplement. And often magnesium is not part of a PCOS picture.
Wow.
Yeah.
I'm seeing more and more. I need to start up with magnesium. Okay. Wow.
Yeah.
Okay. So what about estrogen? Get into some of the hormones a little bit more.
Okay, so magnesium, so what's important about estrogen is there's 2 things: how we metabolize estrogen in the body, and then of course, estrogen dominance. So estrogen dominance happens when we either have an imbalance between estrogen and progesterone, or we can't clear out estrogen properly. So it starts to get recycled into the system, and then it kind of just builds, and we start having more estrogen than we really should. And so what magnesium is involved in is we need phase 2 detoxification. There's an enzyme, COMT enzyme, and that is responsible for methylating or getting rid of your estrogen. And if that is not working, we are not getting rid of that estrogen, and magnesium is the superstar there in having that COMT enzyme work. And there's a lot of individuals that have a deficiency in that COMT enzyme, and they have that increased estrogen in the system. So it's very good at estrogen detoxification. It's very good at regulating estrogen to progesterone. And these are important concepts because, if we have poor estrogen metabolism and poor estrogen detoxification, this leads to serious things. It can even lead down to breast cancer, cervical cancer, ovarian cancer. These are all involved in estrogen dominance, as well as things like endometriosis or fibroids or those types of things, right? So magnesium plays a big role in that detoxification process, more so even if I don't know if you, we run a Dutch test is what we call it here. It's a dry urine hormone test. So it can tell us if COMT is working or not. It tells us how they metabolize estrogen and how much estrogen is getting out. And in the test itself, it specifically states that it needs magnesium to make that go. So yeah, so it's really, really critical. So usually when I see an estrogen dominant picture in practice, it's one of the first supplements I give, because I know they're not clearing it properly. And they don't have a good balance. They don't have a good ratio between estrogen and progesterone. And magnesium is going to improve that ratio. So that it's more balanced instead of it being kind of estrogen up here, progesterone down here kind of thing. So yeah.
Wow. Okay. So you mentioned that magnesium is one of those supplements that rarely cause issues with anything. Is there any way that by taking magnesium, it can do the opposite of what you just said? Or does it doesn't work that way? Like even if you take too much, will it throw it off balance the other way? I guess is what I'm asking.
No, because so this is why we can't, or we have to be careful with people with kidney disease, because how we excrete magnesium is through the kidneys, right? So you'll kind of just like excrete it through there. But unfortunately, if we look at, okay, so if you took too much magnesium, the most common, biggest side effect is loose stool. So you would have a very loose stool, maybe even diarrhea if you really overdid it. But as soon as you cut back, that's it. Like you would just stop the next day and it kind of like regulates itself. So that would be the biggest side effect that you would see from having too much magnesium. Okay. But if we look at how magnesium is deficient, like how we become deficient in magnesium, we can see that that is a really hard thing to do. Like it's a really hard thing to have too much magnesium, because we deplete magnesium so quickly. So if we're stressed, we're going through our magnesium stores really fast. And if we're not supplementing or getting enough of the dietary magnesium into us, it's going to start to go down and we're going to become deficient. If we sweat, because magnesium is part of our electrolyte balance, right? So when we sweat, we're losing magnesium. So if you do go to the sauna, or you do have a lot of hot flashes, if you're menopausal or something like that, or if you go and work out, right? Like you're sweating, you're going to lose magnesium. If you like sugar, you're going to blow through magnesium stores like crazy, because it takes 54 molecules of magnesium to do 1 molecule of sugar. So if you are a sugar addict, you're blowing through magnesium like crazy, right? So then of course there's the medications. So the PPIs and, the beta blockers and corticosteroids and antibiotics. These guys are all depriving us of our magnesium stores. So, and some of these medications people are on all the time. So there's that. And then of course our soils are not where they used to be. I mean, we don't have the nutrients in our soils the way that we did because now we have all these farming practices that have kind of gotten rid of that. And people often go, oh well, I eat organic. Well, that's all great, but organic still doesn't have the same nutrients as it did 15 or 20 years ago. And so we're not getting as much dietary magnesium, and we can't really like replete our sources. So, you're going to be deficient quite quickly. And so that is why I rarely ever find somebody who takes too much. I mean, obviously, if you're going to sit there and take 1,000 milligrams of magnesium, you may have loose stool. I am telling you that right now. But it's not something that's going to kill you. You will just need to back that up, and you'll be fine. But,
wow.
Yeah.
And that was one of my questions, was how do you become deficient in it? What are some of the sources? So that was awesome.
Yeah.
Okay. And you've kind of answered this, but maybe if you could go in a little bit more detail. It's believed in the carnivore community, for the most part, that because you're eating such nutrient-dense foods, and this could apply to keto too, depending on how you do it, why would you need to supplement anything? Because it's nutrient dense. So why would, say, specifically a carnivore, need to supplement magnesium?
So I'll speak directly to a carnivore diet, but this actually is for all diets, whether you are a plant-based or a carnivore diet. And it goes back to our nutrients in our food and in the animals. So if you're a carnivore diet and you're eating grass-fed meat, for instance, those cows are still eating the same grass that's being, like, the nutrients that are in the soil today, the food that they are consuming that is grass-fed, don't have the same nutrients as it did 20 years ago. So remember, we are getting what they are eating, right? So, which is why we want to do grass-fed and antibiotic-free and hormone-free, because we don't want to have all that. Anything that that animal eats or gets is transferred to us. So because those nutrients aren't there in the soil, and the grass doesn't have the same makeup as it did 20 years ago, or even the grains, if you are eating grain-fed stuff, it's not the same. And so we are not getting the same amount of, in this case, magnesium as we did 20 years ago. I mean, if I had to give you an example, if you wanted to eat, let's say, broccoli, and you wanted to get your magnesium stores, you would need to eat 12 cups of magnesium, of broccoli to get your magnesium. Who does that?
Not me.
Right. And you can't do that. And so, unfortunately, in most diets, and carnivore as well, because again, we are eating what that animal is eating. What that animal is getting in nutrition is being transferred to us. And if it's lacking, it's going to be lacking in us. And that's the problem. And then, of course, even if you did get just to the brim of getting the right amount of magnesium per day, look how fast we're getting rid of it. So unless you live in a tent with no stress, no sweating, no medications, no sugar, I mean, you might retain some, but look at all the things magnesium has to do. So it's being used up quite quickly, right? So yeah.
Very well put. Okay, yeah, that makes complete sense. And
Yeah.
so is it your belief, after doing so much research and seeing it in your own practice, that pretty much everyone should be doing at least a little bit of supplementation for magnesium?
I think so. I think, well, you can also get tested. So let's just quickly talk about that. If somebody is resistant, I always say, okay, you know what? Let's run the test. Let's see where you are. But what I don't recommend, there's two magnesium serum tests. There's one that's just called magnesium, and it really just looks at what's in the periphery, like the circulation, and that's only 1% of magnesium. So it's not a reliable blood test. What we want to look at is the RBC magnesium serum test, and this is going to give us a much better outlook on what your body is actually doing with magnesium. And when we look at those numbers, we can see that a lot of them are deficient. I think I've had 2 patients who were just barely over the normal range. Yeah. So most people are below. So that is the test that I definitely recommend that you would get. So you know what, if you want to test, go test, and then you supplement to that. But I do think that a supplement of magnesium is definitely important, because here, we didn't speak about this, but it's really important. Most of us are deficient in vitamin D. Why is that? It's because magnesium needs to be activated in the liver by, like, vitamin D needs to be activated by magnesium in the liver. If that doesn't happen, even if you take vitamin D3, which is the active form of vitamin D, your liver still must activate that vitamin in order for it to be used. Magnesium is that cursor. And so we wonder why so many people are vitamin D deficient when we see the deficiency side on magnesium, and these two must go together. So if you're deficient in vitamin D, you're going to be deficient in magnesium, because you don't have this to activate this. And so it becomes very important. And another thing I want to really emphasize is that glutathione, which is our master antioxidant in the body, if we don't have magnesium, we don't have glutathione. And glutathione is really, really important in our health as an antioxidant. And so for those two reasons alone, if I didn't talk about anything else, I would say, yes, we definitely need to look at supplementation. Yeah.
Wow. Oh, wow. All right. So let's do a few more specifics of how magnesium helps situations. Lots of people are having issues with digestion. How does that play into that?
So first of all, it plays in two roles. And so most often in digestion, we need to look at bowel movements. That is a very important part of digestion. If you can't have bowel movements, there's something going on within that bacteria, the microbiome. And so magnesium is a great way of getting motility, getting bowels moving while we're working on the microbiome, right? So it's great. It's not I don't like using it as okay, here you go, you're on this for the rest of your life and, see you later. No, we want to make sure those bowels are moving. Citrate, magnesium citrate is beautiful at doing that job. And then we can look at doing the underlying work. Also, magnesium plays a role in our actual gut bacteria. So magnesium comes in and is almost like a food for our bacteria, and is allowing the good bacteria to kind of flourish. So, but if we have backups, then we're going to have more bad bacteria building up. And then you see that this becomes like a dysbiosis kind of case. So it's very good for digestion that way. And that is probably the most important reason I use magnesium for people who do have constipation or have trouble having consistent bowel movements. And remember, this is also how we get estrogen out, right? No bowel movements, estrogen is not coming out. So remember that COMP enzyme, it sends it to the intestines, and then this is how we excrete it. So if you're not having bowel movements, this part's working great, but if this part's backed up, we're back to recycling our estrogen, right? So it's very important that we get things moving, and magnesium citrate is wonderful at doing that.
Very interesting.
Yeah.
Okay. Okay. Let me ask you something about your practice. Okay. You apparently use magnesium for a lot of different things in your practice. It seems like it's pretty common. Have you ever had a patient that just did not respond at all, make any difference from the supplementation?
Not from magnesium, but from the form of magnesium. So knowing which form to take is really, really important. There are many forms of magnesium out there. And I think that is also the issue. So a lot of the times I do have clients and patients come in and they say, oh, but I'm already taking magnesium. It doesn't work. And I'm like, okay, so what kind of magnesium are you taking? Oh, I'm taking magnesium oxide. Here's the bottle. And I'm like, okay, that's the problem. Magnesium oxide, we don't absorb it. It's a cheap supplement that they put into magnesium supplements and that they sell. And yet in all of the research, we cannot absorb magnesium oxide. So if your supplement contains that, then you're likely not getting many of the benefits because it's a good laxative. That's about it. So it really, really depends on the form of magnesium. And so I have seen that. I've seen where they've said, I'm on this, but it's not working, and they're on the wrong form. Once we get the form changed over, and, you know, sometimes it's also timing when you're dispensing magnesium. So for people who can handle it, because magnesium sometimes does give GI discomfort on an empty stomach. But if you dose magnesium on an empty stomach, you do get better results, but not everybody can handle that. So that's also something that we have to work with individuals. Yeah.
Very interesting. Do you have any rule of thumb of what types to take for various issues? Like, is there like, okay, if you have this, take this, if you have this, take this form?
Right. So and I have a great infographic on one of my platforms that kind of goes
I'll
through.
add it. No problem.
Yeah. So what it is, I would say the top. So we'll start with bisglycinate. Bisglycinate is like a great all general around kind of magnesium. It's highly absorbable. It's well tolerated. It comes in chelated or buffered form, which means that chelated has more magnesium available. Buffered has less magnesium, but you can then take it on an empty stomach because the GI stuff is kind of taken care of. And it kind of touches on, if you wanted a nice general all around magnesium, you could give bisglycinate. It's probably the one I prescribe most often. Then we have citrate, which we talked about, which is really great for like digestion. It's also great for sleeping. So if you can kind of kill two birds with one stone here, because you could give it at night and it could help with the constipation and with sleep if they have insomnia or sleep issues. And then we have malate, and malate is muscles, joint pain, fibromyalgia, those types of things. Really, really great for that. And then we have L-threonate, which I use this with a lot of my anxiety, depression patients, because it's the only form of magnesium that crosses the blood-brain barrier. So it has a really great effect on the brain. And I actually use threonate. I had an aneurysm that burst in my carotid artery a couple of years ago.
Oh.
Yeah, so I had to have some brain surgery done. And so there was brain inflammation, and I take L-threonate, and it has done so much for, like, even my neurologist is like, wow, you have like no inflammation. And I'm like, wow, thank you. So yeah, so that's very much for cognitive stuff. So, you know, anxiety, depression, mood, memory, those kinds of things. It works really well. And then I also use magnesium taurate, which is more heart cardiovascular. So I'm dealing with people who have maybe arrhythmias or some cardiovascular issues, I'll look at taurate in that instance. And then of course we have your Epsom salts, right? Your sulfate.
I wanted to ask about that.
Yeah. So, and then that's obviously a transdermal application. Yeah, I don't recommend drinking it or eating it, but some people have done this, so I'm not recommending that.
Oh wow, I did not know that. Explain how Epsom salt works. I mean, what is it actually doing versus like if you were to take a pill supplement?
Okay, so Epsom salt is sulfate, so it's going to absorb through the skin. So obviously when you have an Epsom salt bath, you're putting it in hot water. Hot water opens our pores, and then the Epsom salt is in the water and you're absorbing it transdermally. There is not clear research to say how much you are absorbing. So we don't know exactly, but we know that some of it is absorbed. So it's going to come into the system, and it's mostly going to do like a lot of relaxation. So if you're stressed or you have a lot of muscle pain, joint pain, it's going to help that because it's kind of going everywhere and it's in the circulation and it's coming through the skin. And if you're in a bathtub, it's pretty well coming through everywhere from neck to toe, right? So, so you're getting a nice, even kind of incoming stream of magnesium. So that's really what it's used for, more so for rest, relaxation, and muscle joint stiffness, pain, kind of stuff.
So it's definitely not a substitute.
No, I don't think I would use it as a substitute. I would always use it in addition. Yeah. Yeah. Yeah,
Awesome.
for sure.
Okay, as far as supplements go, what should somebody look for when they're trying to find a good brand? Because let's face it, most supplements out there are pure crap, and they have, you know, additives and stuff like that. Is there anything to look for or to make sure we don't get or that we want to get?
Yes, definitely. So we want to look at the ingredients for sure. So you would be surprised how many supplements I've come across where, and this is in the magnesium world, where they've added A oxide, like I spoke about. They like to add that in. I always say to people, if it contains oxide, just put it back, because the problem there is there's no distinction. It doesn't say that there's 10 milligrams of oxide. It says there's oxide and malate and glycinate. So we have no idea. And chances are 95% of that supplement is oxide and the rest is that. So you're really not getting what you should be getting. So definitely look for that. Look for like the additional non-medicinal ingredients. Yes, there's going to be ingredients because they have to make the capsule out of something, right? So whether you get a capsule or a gel capsule or whatever, there's going to be some ingredients there. But if you see color in there or aluminum in there, put it back. I mean, I don't know why it's in there. I don't know, you know, what the purpose of it is, but I have seen these supplements and they're out there. So, and people are purchasing them. So definitely, those are the two big things I've seen. And then the oxide. Yeah. So definitely just look for a supplement that says this contains magnesium bisglycinate at this amount of dosage. Most of them are like somewhere between 100 and 200 milligrams. Yeah.
Okay, so you mentioned a bunch of symptoms, you know, like you take this form for this form for that. What if you have all those symptoms that you need help in all those areas? Do you need to take a separate specific one, or is there something that's in combination that is good?
Yes, so they do sell combinations and you can definitely mix and match your magnesium forms. So what I do in practice is, unless I'll usually give the bisglycinate because it's a nice all general form, but then if there's something else, usually they have one other issue that's really hard. So whether it's constipation or they have a lot of muscle or joint pain or they have, you know, anxiety, whatever, then I will give the additional specific form. Or what I've also done is a lot of my fibromyalgia patients, they now have the bisglycinate, the malate, and the citrate in one kind of dose, like in one supplement, I guess. And there's a nice healthy balance of each. And so I like to sometimes even do that with some really tricky stuff, like where we're dealing with more of the, you know, they're having problems in more areas than one specific one. But usually I'll start with a bisglycinate and then I'll front load whatever the massive issue is going on. Yeah.
Awesome.
Yeah. But it's
Okay.
definitely fine to mix and match the magnesiums.
Dang, we're already almost close to time.
Yeah.
Bummer. That was too quick.
Yeah.
Okay. But I think actually you hit most of what I really wanted to hit on. Yeah. Wow,
I also
you did great.
Yeah. So, and I have a magnesium ebook that I wrote that has everything in there that we've talked about. And yeah, and it's got recipes and all the research, and I've put in all the research papers and stuff like that too, so people can look at it if they wanted to. Because I know a lot of people don't want it to be so nice, sciencey and nerdy, but some people do, so it's there for those people. So yeah, so I just thought I had to like do something to get all this, because a lot of people, especially on my platform on Instagram, are like, oh, can you put everything together so we know that it's all there and blah, 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 blah. And so I did that while we were shut down during this pandemic. So
awesome.
Yeah.
Productive.
Yeah. It took many hours, but I've got it together. It's like 50 pages and it's all on magnesium. So
wow, that's awesome. I will definitely put a link below. And before we go, is there anything that we didn't discuss that you want to just put out there, or do you have any advice for, you know, those of us who are still not, you know, magnesium, you know, scholars, whatever.
I think my only advice is if you are having a lot of gnawing symptoms that you just can't resolve, try magnesium.
Awesome.
I always like to say magnesium is nice. It's not just nice, it's so essential. And I find like when patients come in with symptoms they've had for so many years and they've tried so many things, when I give them something as simple as magnesium, they see an improvement. And that is just incredible. And I think, so if you've been like having a symptom that you just can't get rid of or can't get an improvement on, try out some magnesium.
You've sold me. Okay, I'm going to get a magnesium supplement. But do you have a brand or any specific one that you recommend that you found is very helpful? I know you're in Canada, and that's probably different than what you can get, but
it is. Here in Canada, I like using Designs for Health. I believe they are in the States. They have a really great glycinate product. They have a really great malate product. And then in Canada, we also have a company called CanPrev, which carries the bisglycinate and the malates, and we also have L-threonate by that company. So yeah, I mean, I don't know what brands you have in the States, but I think if you just look at the ingredients, make sure that there isn't any color or heavy metals in there, and making sure that we're not seeing oxide in there as one of the main ingredients, then I think you're probably going to be fine. And just a distinction, bisglycinate and glycinate are the same thing.
Oh, okay.
They're not too different. Yeah. So some companies call it glycinate and some companies call it bisglycinate. So it's the exact same molecule. Yes.
Okay,
yes.
Awesome.
It's exactly the same. Yeah.
So where can people find you? Just quickly go over, you know, where they can get in contact with you.
So I am really active on Instagram. So you can find me at
Yes,
Dr. Barb Woegerer. And I have tons of magnesium posts there, and I talk about it a lot there. And I always post the most relevant research in my stories. So yeah, that's where I'm very active. And then I also have my website, which is barbwoegerer.com.
Awesome. I will put it all below, no worries. So it has been fantastic talking to you. I've learned so much, and I will be checking out a supplement for sure. I'm going to do it, and then I'll have to let you know what's going on. Okay, so y'all subscribe, follow Dr. Barb. And again, thank you. And I think I'm going to have you on again or do a live with you or something, because I have a feeling I'm going to get a lot of feedback on this. So you're probably going to have to be a reoccurring guest.
I would love that. And yeah, perhaps a live later. We should look into something like that for sure.
That would be fun.
Our Instagram people. Yes.
Yeah.
For sure. It's been a pleasure. And thank you so much for.
You are so welcome. Thank you for being on. It has been so much fun. And you have a wonderful rest of your day.
Thank you. I'm going back to patients now.
I'm going back to grandbaby. So there you go.
Love that. Love that.
Well, thank you. Bye, Dr. Barb.
Take care. Bye-bye.